Okay. This is going to be a 10-minute recording of teeth numbers 29 and 30, both of which have not only broken down but lost their fillings, part of the teeth, and have decay. And go ahead and open for me. So we've just placed the rubber dam. And I don't know if you have the sealer. I'd like to go ahead and place the rubber dam sealer in the area. So we'll seal off that rubber dam. My dental assistant just placed the rubber dam. And we are looking through the microscope, set at about 3.5 power. So this is Opal Dam from Ultradent. I'll go ahead and apply that. I'll get a little better seal all the way around, 360 degrees around our tooth. There we go. Real simple to do, easy procedure. And it protects not only the patient from the amalgam, but also it gives us a perfect seal, so no saliva will come back up through the rubber dam. Alright, I'm going to start with a 330 burr on a high speed. We're up to about 8 power right now. I'll pull that back. There we go. How's our focus, Maria? All right. And what I'm doing is I'm just taking out the old amalgam. And how's our patient doing? Everything all right underneath? Great. You can almost tell she's smiling underneath. And if I told her it'd only take 10 minutes to do this appointment, she'd be smiling even more. But it probably will take us at least a couple hours. What you're going to get on this video recording is about 10 minutes of recording, just to kind of give you a brief idea as to what we do when we take care of a tooth that's severely broken down. Here's a little excess of our block out material. I'm going to get rid of that. Alright, so there you have it. The amalgam is gone. She's going to rinse all that out thoroughly. We'll move back to a lower power. And I come right in with my number 6 round burr. Now you're going to feel a little vibration now. We just kind of remind them. Let's see here. And try that again. There it goes. Now you can see the advantage of using a microscope along with slow speed. And so we're now cleaning up with an area of decay. You're okay underneath? Everything good? Alright. We can also find out if there are any fractures, any clinical problems. There we go. What I like to do is, I don't particularly like to use any of the caries detect mediums anymore, because I just feel like they contaminate the freshly clean dental tubules. I hope that's nice and clear for you. We're kind of tripoded up here. We have a built-in microscope camera into the Leica MS5 microscope. That's good. And we're just looking now at that clean up, and we're finding out, well, there is a little fracture line. And we want to clean that up a little bit more right about there. So just air only. And air only, that's it. And get your small air in there. So right now everything is by touch, and by looking at the smoothness of the surface and how it reflects light, one can say that we've got all the decay out of there. Now we're going to do a little bit of a cleanup change. I need an extra mirror. Now we're going to polish the occlusal surface. We're also going to make sure we get all the stain off. And dry. And we got to get that crack out next. Okay, and I'm just going to go in and polish that. All right. Now we're going to use something called cavity cleanser. This is about 4% chlorhexidine gluconate put together in a pre-comp syringe. It's a 3 millimeter pre-comp syringe I like to use. And I'm going to use a smaller burr. Double check an area. And it looks like I'm going to have to go next door a little bit to see my dental assistant. He asked me to floss through a contact, so that's about it, guys. I just wanted to show you the cleanup. We're done. Now we got to put the filling in, and that's our next step. So we're going to remove some of this block out here. I'm going to have my dental assistant Maria do that, and then I'll be right back to fill the teeth. All right, looking good. I just got the patient approval. I guess we're okay. Okay, guys, keep practicing with your microscopes. GERARD CUOMO out.